For some of you who may have heard me before, you know I'm a general dentist outside of Detroit, and I try to be very practical. I love modern technology. I love my diode laser. It's something that I use in my practice every day. You know, we do a lot of implants, and I use my diode laser in my implant procedures. But I try to be practical, and as I said, I love technology, but we want to purchase technology that we're going to use, that is financial rewarding to us, makes us more proficient and efficient. So I'm going to demonstrate a lot of the clinical applications that I use, again, every day in my dental practice, using the DenMat NV Pro diode laser. So as you know, as Lauren said, I am a practicing dentist. We're very busy. We're very blessed, and I love my dental school. And a lot of the information, I do publish a lot. We do a lot of video, YouTube. You can find a lot of the information that we're presenting today in more detail on my education website, drkosinski.com, if you're so inclined. So very briefly, some very quick objectives for the next hour that or 50 minutes that we'll spend together. Very quickly, we're going to talk about the fundamentals of laser and their advantages. We'll talk about the advantages in soft tissue management. My hygienist has her own NV Pro diode laser in the perio department in our practice. We were fighting over it over and over, and so we went ahead and purchased her own, which is something that our patients are very responsive to, and the clinical results are just amazing, and we'll demonstrate that at the end of the program. We'll talk about some of the laser settings and again the clinical parameters and the applications of this very specific diode laser. So, you know, how do you manage soft tissue now if you're going to do a crown prep? I assume that we retract and we use retraction cord. Most of us use a 2 retraction cord system, and we walk away and we let it sit for 5 minutes or 10 minutes. We have a cup of coffee, we do a hygiene check, we do another treatment, and it's a practical way of making a very accurate impression. And I'd like to say too, very briefly, that DenMat has an outstanding dental lab. They are just doing some amazing dentistry for us, restorations for us. So whenever you see anything white in one of my programs, I want to tell you I didn't do any of the white. The dental labs do all of that, and they're very impressive. But all right, if you're going to use retraction cord, what do you do? Well, you're going to prep, you're normally going to numb it, but what if it's a root canal treated tooth? You're still going to numb the soft tissue. With the NV Pro diode laser, we don't have to do that anymore. We can actually do many of our procedures without any local anesthetic, without any infiltration. Sometimes we'll use some topical anesthetic, but it's an amazing instrument. How do you expose an implant? You're going to use some kind of a blade. But again, bleeding problems, anesthesia is required, and going and using our NV Pro 3 diode laser eliminates a lot of the conventional techniques that we've used in the past. And again, the patient response is amazing. And I want you to see how tiny this instrument is. It's the size of a Sharpie, essentially. It's very simple to use, and I know as a general dentist, when we get technology, oftentimes we look at our staff on how to do a setting, how to get it to work, how to turn it on. And with this particular system, I can't imagine practicing without it in the environment that we have today. And here is Stephanie using the diode laser in some of her periodontal therapy. Pocket minimization or pocket elimination, sterilization of pockets, and even in her scaling and root planing techniques. I know at the end of the program that DenMat has some specials, and we do a full day laser program on pig jaws. We do a lot of video demonstrations. We just don't have time to do today. So if you're inclined to incorporate this particular laser into your practice, I think it behooves you to take a day with us and get very, very proficient. And I love when doctors bring their team members, the team members that are going to be using the equipment to our programs. I think it's very, very beneficial. So what does laser stand for? It stands for light amplification by stimulated emission of radiation, laser. What does a laser do? It will cut for us, so we can incise with it, we can expose implants, we can do biopsies with it, we can coagulate blood vessels. Doctors, how do you restore a class 5 restoration that's subgingival and it bleeds? What do you do now? Put a cotton roll on it, walk away, put some anesthetic there, put some hemostatic agent on it, or do the restoration and it's dark blood colored. It's a simple process to pull out this laser, which essentially you can carry around very, very easily, and we can coagulate. We can stop a bleeding site very, very easily. We can cauterize nerve endings, oftentimes without anesthesia. Sterilize wound edges. Our surgical areas heal very well and very quickly. And there's different types of, we have different settings on this particular laser. We can have a continuous wave, which means the power is continuously running through the laser, or a pulse mode, which means an on and off type of setting. Normally I will use a continuous. Here's an example of in northern Michigan, I saw this beautiful woodpecker, beautiful male woodpecker, and doing a pulse mode demonstration. And afterwards, I looked what he did, and he is obviously an artist, because I think that's supposed to be a moose or some kind of a animal. So I normally keep our setting continuous. I know the hygienist keeps it in a pulse setting most of the time. So 4 things can happen to our laser energy when we're using it. We can have reflected light. Well, that's why we have goggles that we wear, the patient wears, everybody in the room will wear. We can get transmission of the light energy, and depending on what we're attempting to do, we can get deep penetration into the soft tissue. We can get scattered light energy, and we'll use this situation for aphthous ulcers or herpetic lesions, and we're going to demonstrate that clinically. It's just an amazing thing. If any of you ever have cold sores, we can treat them very efficiently and basically eliminate them with one treatment. So many patients who experience herpetic lesions will come into the office just for laser therapy. Or we can get absorption, where we're actually cutting away some of the tissue. So, and we want to focus on what's absorbed into the tissue, because that leads to cutting. So diode laser energy, and there's different types of diode lasers, and we're going to focus on the NV Pro 3 from DenMat. It can be absorbed by hemoglobin, melanin, the skin color, water, or pigmentation. Our laser is only attracted to soft tissue, and it's not absorbed by anything else. So it's not going to damage the cementum or the dentin of teeth. It's not going to damage tooth structure. And with this particular laser, it's absorbed by hemoglobin and melanin, or pigmentation in particular. So we can have different settings on this laser to accomplish our goals. So if, let's say, we have a situation, a darkly pigmented gingival color, we might need lower energy to achieve the same result, as opposed to somebody who has a lighter pigmentation gingiva. Just be aware of that. We get tissue vaporization at 100 to 150 degrees Celsius. And for those of you still using electrosurge, we get thermal threshold at 200 or more degrees Celsius, and that's where we get damage of the tissue. With this diode laser, we have complete control. Not only is it shaped like a Sharpie, we have good dexterity, or a handpiece. We're used to going at 150,000 RPMs using our handpiece. We have great manual dexterity with this type of instrument, but we can get very, very predictable end results where we're not damaging the tissue. We're simply using it in the aesthetic zone to achieve a certain result. So what are the benefits? We charge for it. It's a tool that is financially rewarding for you and will pay for itself in a very, very short amount of time. You're going to be doing procedures that the patients appreciate. Again, if you're doing a crown prep, you do the crown prep and you retract, you walk away. You're losing time. Time is very valuable. Time is money in my office and in your office too. And so if it's something that I can pick up and do immediately and get an immediate result, as we'll demonstrate in a few seconds, it's a very, very financially rewarding tool. Patients absolutely are amazed by it. They think it's very, very high tech, because it is. A happy patient will get you more referrals. I'm a big believer in that. We don't really market our practice other than our website. And the best patients that we have are the patients that are referred by other happy patients. Production efficiency, we can improve access in the field of vision. It's fast, it's efficient. We can decrease the amount of treatment time, which both you and the patient appreciate. Making an impression is critical. And again, I'm a general dentist. I'm very, very aware of what we have to go through daily to get accurate impressions. And if we can clearly demonstrate to a quality lab like the DenMat lab the margins of our preparations without bleeding, we are going to get outstanding clinical results. Patient comfort. Again, a healthier approach to tissue management as compared to a scalpel and electrosurge. What does that mean? We get predictability of the healing. Minimal or no need for local anesthetic. And afterwards, the patients are just amazed because we get such fast healing using the dental laser. So, minimal bleeding, minimal postoperative discomfort, faster healing, no gingival recession. It's precise, no tissue scarring, can assist with treatment of periodontal disease. We get predictable results, and you get an immediate return on your investment. What is that value to you in your daily practice? An instrument that you'll use literally every single day in your practice. So let's look at it. The NV Pro 3 laser from DenMat is very small, as I've mentioned a couple times now. It's about the size of a Sharpie. It has disposable tips that allow us to very, very precisely do the procedures that are necessary. There are short and long final tips, and you'll get a set of glasses for everyone in the room, including the patient. It coagulates and cauterizes the treatment area as you work, leading to immediate hemostasis, rapid healing, and reduced swelling. So a patient can go from hygiene to restorative without having to wait. The hygienist isn't going to get as much bleeding, and we can actually, especially in the time of COVID, we're trying to reduce our patient visit times in our practice. So the more procedures you can do in one sitting, the more valuable it is. Some business-wise, FDA is cleared for sulcular debridement of diseased fibrous tissue. Again, Stephanie, our hygienist, I don't think would practice without the diode laser. We can do gingivectomies, gingivoplasties, lesion removals. We'll demonstrate that in a little bit. Fibroma removals, tissue retraction or troughing is something that, again, we use it for every single day. Aphthous ulcers or herpetic lesions, gingival hyperplasia, minimal crown lengthening, frenectomies. I'm going to demonstrate a video of a frenectomy that's amazing. And again, photocoagulation, eliminating bleeding, class 5 subgingival preparation. So with this particular laser, we have presets. And again, during the course, you'll feel very, very comfortable with this piece of equipment. We don't have time to demonstrate it all right now, but we have presets, and you can turn the power up or down depending on the pigmentation or the color of the blood that we're working with. An initiated tip means that we're focusing the energy, and we do that by taking blue occlusal paper and rubbing, or cork if you wanted to. We're actually charring the tip of the cutting or coagulating edge and focusing that energy, and that's what we call initiation. And again, depending on the pigmentation, we have presets for every one of these procedures: laser troughing, class 5 restorations, gingival recontouring, frenectomy, and it'll be a readout right on the instrument itself. Implant recovery, destruction of lesions like a herpetic lesion or an aphthous ulcer. Laser-assisted periodontal therapy can be used as an adjunct to traditional scaling and root planing. Laser energy selectively targets only darker necrotic tissue and actually leaves healthy tissue alone, allowing for the hygienist to treat it and to get better healing and results. Your dental hygienist can use this instrument depending on what state you're in, and the team at DenMat certainly can give you those specifics in individual areas around the country. So we do laser bacterial reduction, and I'll demonstrate again clinical cases where we've had deep bleeding sites, pocket depths that we've reduced 6 to 2 or 3. It's an amazing tool that is very, very positive to the patient, and we get just a phenomenal reception from our patients. Sulcular debridement, again, prior to scaling and root planing. Desensitization, that's a big one. Have you had those patients in your practice where you may have some root resorption or tissue resorption, and they're sensitive, whether it's doing scaling or hot and cold? What are you doing now, doctors? What do? You put fluoride on it? Do you put a desensitizer on it? Does it normally last? We can pull out the laser and get an immediate response by blocking the tubules within the tooth structure. Immediate response that is very, very long lasting. Amazing. So let's go through some clinical things. Laser troughing. Again, these are preset numbers on the laser, so it's very, very easy to use. You're not going to have to look at your staff and say, what do I set this at? Continuous wave. We're initiating tip, meaning we're focusing the energy. So we'll take some blue occlusal paper and we'll just kind of run the laser on top of it. It allows us to get predictable margins, no tissue recession, no bleeding, no discomfort. It's a faster procedure because we don't have to wait for the retraction cord to take effect, which allows us to get precise impressions and high quality dental work. We can get clean impressions. So let's just demonstrate laser troughing versus retraction. Similar situation, 2 teeth right next to each other. I did retraction cord on one and laser trough the other for demonstration. Again, predictable margins, no tissue recession, no bleeding, discomfort. It's a fast procedure as opposed to having bleeding. Having to anesthetize the area can result in discomfort, increased chair time for sure. But we can also get very good impressions, obviously. So here's a tooth that had recurrent decay that we're going to remove the crown. Pre-COVID times, I apologize. You know, DenMat has this Firefly headlamp too, which is just amazing if you have a chance to look at that. But we have presets. You turn the instrument on and you can see it says laser troughing. We can turn the energy level up or down, but here it's preset to 1 watt continuous wave. We are initiating the tip, meaning we're focusing the energy at the tip by taking my blue occlusal paper and just rubbing on top of it. And it allows me to go around the tooth very slow. Now, you have to remember, It's a diode laser. It's light energy. This isn't Star Wars. You're not going to cut somebody's arm off with it. So it's not fast. It's efficient, and it gets the job done. But you have to go very slow back and forth around the margins of that tooth. And we can take our impression, and here DenMat fabricated a wonderful zirconia crown with healthy margins around it and good tissue response. So what's the technique? We're going to initiate the tip. We're focusing the energy. We have a preset at 1 watt, depending on the pigmentation of the tissue. You can turn it up or down. Now, we want to use this instrument and not char the tissue. When you find that you're actually charring or browning the tissue, the energy level is too high. And you'll see in my early cases, there's a learning curve with this. We did some charring. So if you find that your tissue is discoloring, turn the power level down. If you find that you need it to be more efficient, you can turn the power up. We're going to insert the tip approximately 1 millimeter below the hard tissue margin. The laser tip is placed parallel to the long axis of the tooth, between the tooth and the sulcus. And you're just going to continuously go around circumferentially or until the area needed to be exposed and the margins are exposed and you get hemostasis in that area. We will wipe the tissue with hydrogen peroxide. I'll take it on a little Q-tip to remove any discolored tissue so that you can clearly visualize the margins. And the procedure is complete when you can clearly see that the hard and soft tissue margins have been cleared away and bleeding is controlled. So here is another situation where I'm simply engaging the initiated tip parallel to the root structure, about 1 millimeter subgingival, and I'm going slowly around to trough. You want to use the optimum power setting for the patient's tissue and pigmentation, and the assistant is going to blow air on the area or have a high volume evacuator to keep the tissue cool. And remember to use the appropriate power setting, and it's a light brushing stroke to disperse heat and allow the laser to vaporize. If you take your time, doctors, you can do these procedures without any local anesthetic whatsoever. It just doesn't hurt the patient. If the patient complains about gingival recession, or you do get some charring of the area, you're just using too high of a power, or you're not moving the laser tip fast enough. Excess charring from excessive thermal damage of collateral tissue leads to recession. So just be aware of it. There is a learning curve. Practice. So let's demonstrate a tooth preparation. We're able to laser trough. We have no bleeding. We're able to control the area very well. If this is a root canal treated tooth, we can do this procedure without any anesthesia. And again, the team at DenMat is making some phenomenal crowns for us. Just very exciting. Another situation, a more difficult situation where we have a tooth with recurrent decay that we're going to remove. We're removing the decay, and we can chop up that tissue, right? This is not unusual. And sometimes it's very challenging to even use retraction cord in these sites in bleeding. And these are the areas where we sometimes have challenges in getting an accurate impression. I know we do it, we're general dentists, we do it, but we have to take our time to achieve high quality dentistry for our patients. So again, it's an instrument that we use routinely in our practice to get the results that we want. Same patient, opposite sides of the mouth, where we're replacing crowns for whatever reason. We're going to remove those crowns. On one side, I'm simply using the diode laser, and you can see we can have some bleeding around the area, especially if there's decay, or we prepared deeply, or we traumatize the tissue. We're kind of going around, and we can control that bleeding and see our margins very clearly. as opposed to using retraction cord, a double layer of retraction cord where we have to walk away, allow the tissue to get hemostasis. It's uncomfortable for the patient. Here we're taking our impression using DenMat materials, and we basically get the same results, right? I'm not saying that one method can get a result and the other method can't. We're getting those results. We've always used a retraction cord, but it's just a very efficient way of doing something that using something that clinically you demonstrate in your practice every day. Here's an interesting case, and I won't go through the history. We would usually take a little bit more time in our courses, but this lovely young lady obviously had some issues, recurrent decay, and we went ahead and decided to do some nice crowns. And this is another tool from DenMat that I love. It's called LumiSmiles, and it's an app on my iPhone where we will simply take a snapshot of the patient smiling, and within I want to say 15-20 minutes, both the patient and the doctor or the staff will receive a digital or virtual markup of what we can or could achieve with our aesthetic dentistry. It's pretty amazing. So here we're just taking a photo of her smile on my iPhone. And again, this is sent to her email or text. And I'm telling you, doctors, what these patients immediately do is they are on their phone and they are sending this out to family and friends. It is a very, very self-motivating method, one method of treatment planning a case. How did we show patients what they could look like before we had this? Well, what I did is I would take an impression, I would do a diagnostic wax up, have the laboratory do a diagnostic wax up, bring the patient back, show them a before model and an after model. I'm not even sure they really understood that. Give the patients the model to take home, let their family see it, as opposed to something that in our digital age that they will receive in a very short amount of time. So look into it. I think it behooves you to at least look at LumiSmiles and see if it's something that you could incorporate into your practice. So we prepared those teeth, and we're going to do laser troughing. We prepare, we control the tissue, we control the bleeding, we get a nice clean impression. We're sending it to our DenMat lab where they fabricate our nice final crowns. This patient ended up getting pregnant shortly thereafter, so we're waiting to do her mandibular arch shortly. But we're able to control things pretty well, and the patient was very, very happy with the final results. Peg laterals, patient that came in wanting full arch veneers, and I'm a very conservative dentist. She was a very young person, and I said, you know, let's just try to do the laterals first. I really don't want to grind down your healthy teeth. Maybe I'm a bad salesman, but what we decided to do was to just prepare slightly the lateral incisors. And here I just wanted to show you with the LumiSmile. I showed her this, and she goes, "Wow, you can do that? Yeah, let's not do all veneers, 8 veneers in the front. Let's see what we can do." Showed it to her parents. They agreed. If the results weren't what she wanted, we could always go back, and I told her we could go back and do the veneers later. So again, we have our settings. We're initiating the tip, creating energy, and one side I went ahead and used the lasers to trough. I'm using my hydrogen peroxide to clean off any char tissue, and on the other side I use retraction cord. Very typical of what we do every day in our practice. No bleeding, seeing the margins. Taking our impression, again, we're getting a very similar result in our final impression. And here the laboratory fabricated a master cast, and we're able to fabricate our porcelain crowns to the satisfaction of our patient and the patient's family. Gingivectomies, again, initiated tip, focusing the energy, getting positive results, no tissue recession, no bleeding, no discomfort, and I'm simply able to do some minor contouring. I'm not going to call this crown lengthening per se, but we can do some minor tissue lengthening, again, being very, very conscious of the biologic width in these areas, and the tissue has a tendency to heal very, very well in a very short amount of time. Presets. And here, we're doing an implant, taking an impression, and I wanted to just do a little contouring of the central incisor as we took our impression, so to give the laboratory a little bit better results. So let's just show a really very, very short video. Interesting lady, she just wanted her teeth to be a little bit longer. And so we initiated the tip. And we're simply doing a little gingivectomy procedures, lengthening the teeth to some degree. Probably could have turned this power down a little bit. And seeing how this works, again, high-speed evacuation, very slow, just doing some little tissue contouring where she felt the gingiva had grown over the top of the teeth a little bit, and she just wanted a little bit more aesthetics in that area. I'm going to run this a little quicker so we can get through our procedures here. And you can see we're just doing a little contouring using some hydrogen peroxide in the area. And so you get the idea of how it works. So let's look at a frenectomy. Frenectomies, how do you do a frenectomy now in your practice? What I used to do is take a hemostat on either side, take a scalpel blade, then you would have to use a suture to kind of keep it, where with a laser, I'm not using suturing, I get very little bleeding, very little or no discomfort. Again, maybe a small amount of topical anesthetic. We're initiating the tip, focusing the power level, and again, very, very briefly.
We have a lovely lady here.
Again, pre-COVID.
Denture that Dr. Schaefer would like the frenum removed in the anterior region, which is kind of holding up that denture, creating a little bit of a sore there. I did use a little bit of topical and a little bit of local anesthetic to the site. But again, going through the process, we have our red button, we turn it on. And we have a password menu button, laser mode. Again, it says procedures, and we will scan till it says frenectomy. Again, because we are incising, we're going to initiate the tip by just simply touching our blue approval paper. You can see it says 1.2 watts continuous wavelength. The patient knows if there's any issues, she'll raise her hand. It'll go pretty quick, okay? If you can turn to me just a hair, better with the light off.
Either one's fine.
And it's good. It's a slow process. But what I'm doing is incising that frenum area. I know we want it to go faster. I'm getting some soft tissue falling up. I'm going to wipe it. And you need to initiate the tip. And we'll come back. And again, it's not Star Wars. It takes time. You okay? You feeling it? Is it hurting? Or just a little tingle, a little warmness? So she said she was feeling a little warmness there, not pain though. Okay, just, you kind of know I'm there. And I'm just going to go slow. Again, and you can see I'm starting to incise that, bring them a little bit. And just take your time and let it cool down a little bit. It's thermal. We have a
Implant Recovery is another tool that I use every day. Many of you know that I do a lot of implants, and I try to be very, very efficient. You can use this laser around metal components. You can use it around amalgams or crowns. It will not spark like an electrosurge. It does not heat the implant. Again, and oftentimes, how do you uncover an implant that's buried, for those of you who are doing implants? Well, you have to anesthetize the area. Again, another shot that the patients aren't thrilled with. But again, using the laser, oftentimes you could use a little topical. We use a lot of buffered anesthetic in our practice, but it's very, very non-invasive. We can expose the top of the implant and allow us to get a very healthy gingival cuff around those sites. So again, implant recovery, presets can't be simpler. Focus the energy by initiating the tip. Here I'm doing it without anesthetic. Very, very typical. Removing the cover screw or closure cap, and I can immediately go to an impression without fear of recession, without bleeding in my impression material. This is immediate post-op where we're putting a healing abutment. Again, this is not an implant course, so I'm not going to go into too much detail with that. But what this simply does is allows the soft tissue to form a cuff around the implant. So no more anesthetic after this point. 1 week post-op, tissue is healed beautifully. And again, for uncovering full arch areas, I'm going to go a little bit quick here so that we have time for questions. We have our implants precisely placed. We know where it is. And I'm simply using my diode laser to uncover the implants without anesthesia, without a lot of bleeding. And here we're putting our healing abutment in place, as opposed to having to numb the area and using a blade. Here we're using a tissue punch, which is just a circular blade. And you can see the amount of bleeding that you're going to get by incising, as opposed to a laser. Now, also, this is a very important slide, and I'm going to slow down a little bit. The anterior, the top healing abutment is created with a laser, where the bottom one, we did a tissue punch. Look at the amount of recession that occurred 1 week post-op in the site where we had to incise. Now, is this significant in an overdenture? Well, no, it's not significant in overdenture. Could it be significant in the aesthetic zone? Yes, it could. So again, this is a tool that makes me very efficient and proficient in treating. Biostimulation, what does that mean? We're using this for herpetic lesions, aphthous ulcers, and desensitizing. It's a non-initiated tip, which meaning the energy, the light energy is actually spread rather than focused. And we're not touching the lesion. Non-contact. Low-level laser therapy. It increases circulation, collagen formation, osteoblastic activity, and fibroblastic activity. So in a non-initiated tip, we're actually spreading the energy and we are not contacting the lesion. We use this for laser bacterial reduction, aphthous ulcers, canker sores, herpetic lesions. When we're cutting, we're doing gingival recontouring, frenectomy, laser troughing, laser curettage, minor soft tissue crown lengthening. So let's look at a herpetic lesion. Presets, it will help kill the bacteria, no discomfort, pain reliever, faster healing, no anesthetic. Patients will flock to your office for treatment. How do you treat these now, doctors? You know it's a very painful procedure, week to 10 days. It affects people's lives. It's embarrassing, no kissing. And here I'm taking my diode laser. I'm not touching it. I'm maybe 1 millimeter to 3 millimeters away. 1 week post-op, it's gone. And our patients respond so positively with this. It's amazing to them. Quick video demonstration. A little aphthous ulcer. Preset. And you can see we're not touching it. I'm actually placing the laser from the center and just making circumferential circles to 1 or 2 millimeters beyond the lesion. The patients may feel a little warmness, a little tingly, but the lesion will go away in a very short amount of time. Another herpetic lesion, not touching it, very routine. Patients will actually come to your office asking for this therapy. Immediately following treatment doesn't look that different. 1 week post-op, patients came back for photographs. Just an amazing result. Painful herpetic lesion. Again, preset, biostimulating. And again, in our courses, our all-day courses, we can take a little more time and demonstrate this. Not touching the lesion, 1 week post-op. Positive, positive result to our patients, day after day. Angular cheilitis, very typical in Michigan with the dry weather, saliva, overclosure, can be very, very painful, all kinds of creams and lotions, and we'll use the biostimulation to try to relieve that. A Mucocele, a very simple procedure. Here we're initiating a tip. Here I'm using a cork, and we can actually vaporize that Mucocele, and 1 week post-op, it's basically gone. This was a young girl that came in with a Mucocele, a real fat pad, just a lovely young lady with her mom. And what we did was we were able to remove this lesion. It was pretty deep. There was a lot of fat in that area. Mom wanted to. The pediatrician wanted her to go into surgery with sedation. And I treated her dad, and they came in, and this is 1 week post-op. It's just amazing technology to me. Tongue lesions, is that a bite? That was very painful for the patient, and Stephanie used biostimulation, and the patient came back 4 days later, just amazed, just was so grateful that we were able to treat. Traditional periodontal treatment here, this is a good 4-hour program. We use it as an adjunct to scaling and root planing. Pocket elimination, how did we do it before Arrestin? I never had a really good positive result with Arrestin, and it's very expensive. We refer to our periodontist for more involved reflection flap surgery, which can be expensive, painful, bloody, require sutures. Laser-assisted periodontal therapy, it's a 2-step process in conjunction with scaling and root planing. So we can reduce the bacteria count in a sulcus in conjunction with our scaling and root planing. We can use it for laser curettage, which, as I mentioned before, we can help soften or break up the calculus that's subgingival. It will not damage the tooth structure. It works on pigmented tissue. And oftentimes we can take very, very deep pocket areas and reduce those pockets dramatically. And when you start showing the patients these results, they are very responsive and very appreciative of what we're able to do for them. Bacterial reduction, again, presets. It can be either a continuous or pulse mode. Stephanie likes to use the pulse mode. It reduces the bacteria in the pockets, reduces the bacteria entering the blood system. She does it without anesthetic, improves the effectiveness of laser-assisted periodontal therapy, and can soften the calcium deposits. So bleeding on probing, laser therapy using the diode laser, and basic elimination of the pocket, creating a healthy, bloodless field post-operatively. If it's in a continuous mode, we have one setting. If you're going to put it in a pulse mode, we double the energy created. We increase the setting for more advanced periods. A lower setting is done for gingivitis. Laser bacterial reduction is not initiated, meaning we're spreading the energy, we're not cutting anything. And if doing sulcular debridement after scaling and root planing, then initiating the tip can be considered if it's allowed in your state. And you have to be very conscious of what hygienists can and can't do in particular areas. So again, as we're getting close to closing, so we have questions, I have time for questions by Lauren at the end. We have deep pockets that we can minimize bleeding and probing very efficiently, very effectively, very, very routinely in our practices. Around brackets, cleaning areas around brackets, it's just a wonderful, wonderful system. As an adjunct to that, the hygienist Stephanie will also use a product called Perio Restore. It's an at-home perio defense system. Consists of customized trays made by DenMat, and it uses 1.7% hydrogen peroxide, and which goes deep into the periodontal pocket. And we're getting really, really positive results. Periodontal disease is caused by anaerobic bacteria forming plaque. When periodontal disease is not controlled, as we all know, it leads to other systemic issues. We get customized trays. The cleansing gel reduces bacteria, using it 10 to 15 minutes twice a day, and it will help fight the bacteria inside the pocket and help or minimize recolonization. When do we use it? When does a hygienist use it? For patients that have inconsistent home care, any stage of gum disease, have extensive restorations, crowns, bridges, where they're having periodontal issues around those restorations. They're at high risk during medically advanced treatment. Even patients with perfect healthy gums can benefit from it. And it's a very simple mouth guard type of material. Stephanie, the hygienist, uses for sulcular debridement, selectively removes diseased epithelium, does not harm healthy tissue, and allows the healthy tissue to regenerate. We get consistent reduction of 6 millimeter or more pockets to 2 to 3 millimeters. And again, be aware of what the hygienist is allowed to do in your individual state. And I love to show this case. This is an old blade implant in an elderly patient that was very, very traumatized, bleeding on probing. Most of us would go back and remove this blade implant or send it to a specialist to have this implant removed, which means that the entire restoration would be lost. The patient had a very atrophic mandible and would truly become a dental cripple. So we pulled out our laser. 4 weeks post-op, we were able to eliminate the bleeding and probing, eliminate the swelling and painful area, and we're able to maintain that blade implant for a longer period of time. Desensitization, as I mentioned, we'll run through this rather quickly. What we'll do is we'll simply apply a layer of fluoride varnish. And again, we're biostimulating. We're not actually touching the tooth, which will occlude the dental tubules. And we get a very long-term result, better than anything I've ever used in desensitization. And it's immediate. It's immediate. You could have a patient come in sensitive. We'll use the fluoride varnish, biostimulate the area, and immediately I could put an ice cube on that area and the patient won't have a negative response. So we put a varnish and we're able to biostimulate the area. So in closing, and I think we're pretty much on time, Lauren, it's a benefit for the patient. The patients are very responsive to it, but it also can be financially rewarding to the doctor. And here's just some CDT codes and fees for certain situations. This is a tool, as I mentioned, that I use every single day in my practice. The hygienist uses it every single day in her practice, and we're able to provide high quality, efficient, proficient care to our patients.